Hello and welcome to this special lightning talk on behalf of Fullscript. I'm James Maskell, and I want to talk a little bit about group visits. Obviously, earlier this year, a couple of months ago, I brought out this book, Community Cure, Transforming Health Outcomes Together. And the thesis of this book was all about the use of group visits to make functional integrated medicine affordable, accessible, and actually successful. Like, how do you get lots of people to change behavior simultaneously? In that book, in chapter 7, I talked about the future. And one of the things I talked about there was virtual group visits. And I want to just share this with you because I feel like whatever your practice situation, whether you're taking insurance, not taking insurance, whether you're primary care or nutritionist or whatever role you're playing, the opportunity to use technology to be able to bring and introduce members of your patients together is still there and is absolutely crucial. Now, there are options to doing this. Like, let's first of all think, what is the difference between a webinar and a group visit, right? In a webinar, there's a one-way transmission of information, right? So I'm telling you things and you're listening to it, kind of like this right now. With a group visit, what you're really trying to create is ways for people to engage with each other. And what you'll see is that it's less important about the content that goes out and more about setting up an environment where people feel safe to engage. The reason why this is super important and more important than ever is that loneliness is still the biggest driver of all-cause mortality. And so even more reason to start to build community in a digital environment. And actually, as a practitioner in this world, how do you set yourself apart again from all of the other doctors, all the other health professionals in your community by doing things that they won't do? So we've seen people starting to do virtual group visits as a way to as a free gift to their community, where they can start these virtual groups. They can run them on a technology like Zoom, and they can invite their patients to them, add value to them in that moment, and then suddenly, say, hey, look, and by the way, we have paid for telemedicine services. So you can sort of use it as an advertising structure. We've had some people that, like Dr. Cheng Ron, who are doing virtual group visits plus remote patient monitoring and billing that to insurance, which is really exciting and a new model for decentralized health. But more than anything, I would just encourage you to reach out to your community. Use this opportunity to reach out to the patients that have been to your clinic before, current patients, past patients, engage them into a phone call and see what they're looking for. And ultimately, if you could set up a few virtual group visits on Zoom and have an opportunity for whoever's calling them up to engage people at a time that works for them, there is an opportunity here to grab the attention of people and for those people to invite other people. And so I would highly recommend that at this time, you start to get familiar with a technology like Zoom that can allow you to not only speak to patients, but allow patients to speak to each other. Because creating structures where people can engage with each other at this time of social distancing and social isolation couldn't be more important. So if you want any other resources, we did a webinar called Virtual Group Visits, how to run them, how to bill for them, how to organize them. And you can find that on our website, goevomed.com. If you need any other help, please feel free to get in touch. Thanks so much to Fullscript for the opportunity, and enjoy.